Hey guys, my name is Peter. Here to talk about TMJ and a surgery I had Monday here at Shands Hospital in Gainesville, Florida. I live in Tampa. I've seen a lot of TMJ forums, a lot of them females. I haven't really seen too many males on there, kind of explaining their road to recovery and surgery and whatnot. So what I had done was I had a open surgical procedure, bilateral eminectomies, which basically means they made an incision on each side of my face and shaved down the articular eminence. So your jaw joint is ball and socket and hinge. So this is the eminence. Right here, when it dislocates, it gets stuck there, so they shave this part down so it's flat, so it no longer locks. Don't freak out if you have TMJ and your jaw has dislocated. This surgery is reserved for the worst cases. They will try as many conservative measures as possible before they do an open joint surgery or even orthoscopic surgery because of the risk associated with it. So came in here Monday. Today's Tuesday. Should be leaving tomorrow. If you could see, I had a little bit of bleeding. I had to put a towel to so my shirt wouldn't get bloody, but see if you can get a look at these incisions at all. That's one side, and here's the other side. And it goes basically through my ear. You can see, I had blood coming out of my ear as well. They basically leave this dressing on for 24 to 48 hours, just for, reasons like this, bleeding, comfort for your jaw. So the main thing is that with this surgery, that's different than other surgeries, like for a hip, knee, shoulder. They can do a regional nerve block, which means you'll wake up and you'll be numb and you won't be in as much pain. When it comes to your jaw, you have a major nerve in your face, so if you take your palm and go like this, the nerve branches out, so it controls your lips, your nose, your eyes, frowning, your cheeks. So they can't do a nerve block because then that will compromise their neuro checks that they will do after their procedure. With that being said, I woke up in an excruciating amount of pain, and that can only be managed by pain medication, which they did really well with that. So for the first night, I was on IV pain medication every 2 hours, also with oral pain medicine every 6 hours. The next day, they upped the oral pain medicine and lowered the IV pain medication every 4 hours. The goal, you can't go home, obviously, in IV pain medication, so they gave me one last dose of the pain medication and upped the oral medication even more. So I'm on a pretty strong dose. I'm also on anti-inflammatories. Your best friend in the hospital is going to be washcloths that are in bags of ice, and it feels amazing against your skin. Also try to distract yourself as much as possible. Be friendly with people. You're gonna probably be needy. It's not a pleasant procedure. Before this, I've been dealing with TMJ, which stands for temporal mandibular joint everyone's got it. So the disorder of the joint is called TMJD. Mine was chronic dislocations. The conservative measures that I've taken, which they'll take with everyone at first, is therapy, mouth guards, splints, muscle relaxers, therapy, stress management. A few years ago, I had a ZMC fracture that I never got taken care of. I started grinding my teeth, plus I have an anxiety problem, so grind my teeth when I get anxious. Anyway, my jaw dislocated frequently, led me to go into emergency rooms, procedural sedation numerous times, finding a maxillofacial surgeon that specializes in the joints is very hard. Maxillofacial surgeons, fractures, they could handle that. It takes a TMJ specialist to actually do any kind of joint surgery. Then, when those conservative measures failed, which I've had, the muscle relaxers, I've had my jaw screwed and archbarred and wired shut just to prevent it from dislocating. I have had the arthrocentesis, where they go in your jaw joint with a needle, aspirate the joint, and inject a sclerosing agent to create scar tissue to try to stop that. These measures didn't work. A surgery that is not really popular, that they also consider doing sometimes, I guess, is what they call a down fracture of the zygomatic arch, and put mini plates in screws, basically putting a break in front of the eminence so your jaw won't dislocate. That surgery is less invasive, and it's less successful only because if you could still dislocate with that, with the metal plate, and the plate can break, and if you dislocate with that in your mouth, you'll probably end up having to go to the operating room for an open reduction. This procedure is a little more invasive. They shave down the jawbone, the bone, and that's how they do that. And it's called an eminectomy. Has a very good success rate. If this fails, though, then my only option is the last option, which is a total joint replacement of my jaw joints. Because once you take away bone, you obviously, you can't really regrow it, so they have to do a joint replacement. But I'm going to stay positive about it. Anyway, any questions anyone has about TMJD, I'd be willing to answer anything and my experiences with this procedure, what I've been through. I'm lucky to have had my wife and daughter here until I woke up. I lived 2 hours away. I had to come all the way to Gainesville to find this guy, Dr. Dolwick, Franklin Dolwick, who is a TMJ specialist for over 40 years. His resident, Dr. Christopher Hambrook, has been great. Overall, it's been a pretty good experience. I have a private room, which I could show you. My own room. The only thing that sucks is the TV. I've been in the hospital before for my jaw, and I'm used to a flat screen TV with a keyboard, so you could surf the web and play games, movies, stuff like that. Overall, though, it's been a pretty decent experience. Word of advice, though, when your pain medication is due, I would highly suggest, because the nurses can be busy, I would suggest starting to call them about 15 or 20 minutes before you're even due, and you might still get them late. Pain medication is crucial because you don't want to wait until it gets excruciating. You could also see that I even had to put a towel on my pillow for some of the blood. Once this comes off, I'll make another video and update my progress. I have a little bit of swelling over here. Eating, obviously I'm on a mechanically soft diet, but even that could be difficult. It was for me today. The first day was almost impossible. Today was a little bit easier. So you're gonna have to get used to a soft diet, which is not bad. You can have eggs, mashed potatoes, chop up meat. At least it's not clear liquids, which it is when your jaw is wired shut. Anyway, the whole point of this is to try to educate people about TMJD and my experience. Anyone that's having a procedure or is familiar with TMJD, I'd be willing to share my experiences. Subscribe, like, comment, ask questions. I'll be sure to reply. I've seen other people do this on YouTube, and maybe I'll get a similar outcome. Another thing, distract yourself as much as possible. The only social media I have is Snapchat, so I can video my family, but they have these funny faces. So if you YouTube Shands Hospital, you'll see me in a tiger face, basically saying I was supposed to have jaw surgery and I woke up with a new face. Yeah, pass the time like that. Friends, family, all that's important. Music. It does get better. I was nervous beforehand. They took care of the anxiety. The pain has subsided substantially. And I'm looking forward to going home tomorrow. And I'll take a new video when this comes off and let you guys know how it's going. So, like I said, any questions you guys have, this is also called a jaw bra, by the way, which I have some at home saved, so I'll probably end up changing it if I need comfort. Anyway, again, this is Peter Bonfiglio, and this is my video about TMJ surgery. Thanks for watching.